Well, first and foremost, for me, it is about providing a package of support to practices and networks to facilitate innovation on the front line. We live in a really challenging time in primary care, and I believe that actually by using digital solutions in a smart way, we can improve our efficiencies, not only in terms of the way we interact with our patients, but also in terms of the processes within the practice or the network.
The patient downloads the app, they register to use the app, they can book and cancel appointments, they can enter in symptoms and queries, and then what we're calling pre-GP is the online consultation piece. So it's like online banking. We've all got mortgages, bank accounts. I've never seen anybody at the bank. So we're following the same process.
So digital access is not only about keeping up with the times and the changing pace, within the world that we live in today. It's all about using it to our advantage and using it to not only enhance the care we offer our patients and how we communicate with patients, but it's also about working digitally smarter to make efficiencies.
With our system, what we're trying to do is get them off at different points along this line to do something else. So they can either go to the pharmacy and use pharmacy first if that's available. They can either educate themselves, they can have a telephone appointment, they could see a nurse, and if they're adamant, they can still see a GP. So we're quite different in that respect, that we're not stopping the patient. Because the thing is, if we tried to stop them booking a GP appointment, they'd find a way around it. They'd be stood at the door at 8 o'clock in the morning, they'd be ringing up, unless you're taking your appointments off even online. Current experience with my father, GP appointment, I didn't know, because of where he is in East Lancashire, there's a self-referral spine clinic. He's been waiting for a GP appointment. He literally turned up to see them. If I'd have had this functionality and saw spine clinic, self-referral, click here, a call, he wouldn't have gone to the GP, he wouldn't have seen the GP. So here, this is where you can promote services that are your practice specific, or CCG. Again, it's up to you how you design that, but it's up to you what you want to put on there. A lot of patients just book a sick note appointment. They don't actually even know you don't need one for 7 days. So what we notice is a lot click cancel, and then they come back in a few days.
We also have the opportunity to have completely new methods of care, engaging with patients in ways that enhance their care, which would be unable to do so unless we came through a digital channel.
From an insurance perspective, it's about end-to-end processing, so the insurers that are enabled for IGPR have the ability to send a request to your practice on behalf of a patient, which will automatically allow you to then process the request through the software. Ultimately, the insurer should only receive the relevant and necessary information. So the purpose is to actually ensure that information that sits in the record that shouldn't go back doesn't go back. So we'll generate a subject access or a full copy notes, as some practices refer to them, and it will then analyse the record to ensure that in this instance it removes primarily references to third parties, so it will go through and remove those third party references for you. Working with NHS England, again, there's around about 900 codes and about 2,500–3,000 words and phrases that you would potentially find in a record that cover aspects of mental health, all those types of things, domestic violence, anything that you might find in the record that you would want to be aware of before giving a patient access. To screen a record is quite a significant thing. There's a lot of data to go through, and if you're doing that manually, I think the test sort of showed it's anywhere between 20 and 40 minutes manually, whereas this takes literally 2 clicks, and as long as it takes to go through the record, which is usually sort of about 30 seconds to a minute.
Over the coming months, we're hoping to put on events in other areas and provide sort of updates and progress reports on how everyone's doing.
We realised we did have quite a healthy PPG who were engaging in our face-to-face meetings, but they were all of one type of people. We tended to have all the white British people who are relatively healthy and retired, and I found that right across the board that tends to be the case with most face-to-face PPGs. We wanted a bit of a more diverse group. We wanted to know what other patients actually felt about the surgery. So I wanted to do a joint meeting side by side so that we could gather the comments from the people sat in front of me and the comments from people that were at home, work, wherever else they were commenting from, and bring them together so we could all talk and discuss within one meeting exactly what was going on with the practice. Mainly, people were really pleased to see doctors on there who were actually giving them the answers they wanted. A young man who none of us knew, wasn't recognisable to any of us because he was probably quite healthy, so he didn't actually come to surgery. And he had put, "Thank you all, this has been really good. I normally only experience the practice just attending the occasional appointment. This has been a really great experience." Basically done almost like comments. We're not doing a live, there's no video. Not yet.
Whilst undoubtedly there are patients who cannot access the services through digital technology, we do need to move as much as we can into the digital channel in order to free up our other channels, so that those that are digitally disenfranchised have better access than they currently have.
We've got a number of different types of digital software and online consultation and different programs that we want to roll out. But we didn't just want to hoist it on primary care, so what we did instead was we put a call out to the practices and said, if you want to be an exemplar and you want to work with us and work with new and exciting types of technology, come forward. And this event today was very much about this is who we are, this is what the programme will be about, and also sowing the seeds around building up a network of exemplars, because we want the practice staff to be championing digital as well, and that's very much what this was about.